Have the majority of
Mhm.
patients that found you at Select Health, have they first relied on insurance covered treatments and just not gotten relief from their symptoms?
Yes, and I would say that that would be a vast majority, just like you or I who work hard for our insurance, either provided by our employer or self-funded. You want to use that insurance. And so, of course, when someone has pain, numbness, or tingling in their feet or their hands, the first place they're probably going to go is their primary doctor, who is most likely in their network, and they would be paying a copay. And they proceed down this path, whether they then get referred to a podiatrist or a hand specialist or even a neurologist. All of those roads where they've been making their co-payments and they're seeing their in-network providers, every single one of those paths leads to a prescription pad. Because in an insurance world where you are staying in your network, you're making your $10, $20, or $50 copay, and I would want to do the same if it were me. But the majority of patients that come here realize that they've now exhausted their in-network providers. They realize that all they're being offered are prescriptions and nothing is really making a dent in their symptoms, their quality of life. And despite having not paid that much out of pocket, they're not getting any better. And so at some point, a value judgment has to be made, because at what point is someone going to just continue to go down the same path with the same result, which I guess is the definition of insanity, as they jokingly say, trying to do the same thing over and over and expecting a different result. So we are vastly different here. It is not an unaffordable clinic, but it is one where we offer curative treatments. We offer things that will reduce their symptoms because the nerves are healing, and that isn't always covered by insurance. But patients never get surprised in our clinic. They are explained that insurance largely doesn't cover the type of treatment that they really need, but what did the previous treatment provide you with? Nothing generally in the way of relief, because it's not truly healing. So again, when you talk about, do we care for them? Absolutely. Can we help them? Yes, we help every patient that we could take on. And we are quite open and honest about the fact that although I would like for insurance to cover all that they're going to encounter, the reality of it is they've done that. They've been there for years. They've paid their copay with the realization that an insurance-driven protocol, whether it be by their primary doctor or even a specialist, is just not getting them better. And they come to the conclusion on their own, I may have to pay some more, but I would like for this to really be addressed in a way that is going to, again, improve my quality of life on a day-to-day basis. And that's what we provide and explain to patients when they're here. Patients report to me all the time, I have never had someone spend so much time explaining the process of peripheral neuropathy and why it may have come and what it may be doing and what it might do in the future if we don't do something to help allow the nerves to heal and repair. So first and foremost, I am not constrained by any time. So each patient is generally given about an hour on more than one occasion to spend with me one-on-one to explain the process before we ever enter into treatment or even determine that they're eligible for treatment, as opposed to what they're used to, which is a 30-second explanation, some presupposition by their physician who was in network, and they're essentially writing their prescription before they even explain what their problem is. And it's not always like that, but in many cases it is. And the thing that, as a patient in that system, and also something that gets explained to me by patients quite often, and frustratingly so, is that oftentimes the doctor will have their hand on the doorknob or on the lever, basically trying to escape while the patient is trying to explain why they're in their presence in the first place. That's not acceptable. It wouldn't be acceptable to me as a patient, and it certainly is not acceptable as a provider for people that have suffered necessarily for months and or possibly years. Additionally, most beneficial state-of-the-art treatment is not readily available to in-network providers because they are under a cost containment system. Insurance companies have huge skyscrapers in the sky because of the money that they receive. I am not run, owned, governed by any of those systems. The ability for us to have patients who want to be here, who understand that the process, perhaps not in network, is going to change their quality of life, are willing to pay for that, which allows for us to secure state-of-the-art, up-to-date, new equipment in an office environment that is pristine, beautiful to look at, beautiful to come to, and they know that they are being cared for in an environment that is fitting for the outcome that they are seeking. If I was held under the restraints of an insurance-based system, like so many colleagues are that treat this condition, I would be no different than anyone else who writes a prescription that may help your symptoms, but certainly won't help the progressive worsening of the condition. So in the environment where we are outside of that system, it doesn't mean I don't respect people's desire to use insurance, but they've done that. They've exhausted that, and they're worse because nothing was ever done, again, to help them heal and repair. Where I have the luxury of being able to provide state-of-the-art facilities, time that they need to figure out what treatment they should have, and if we can help them. And then, of course, equipment commensurate with that to provide the treatment so that the outcomes are what they should reasonably expect. There isn't a medication or prescription cure for peripheral neuropathy. So these patients grow increasingly frustrated. They grow to have increasing despair. Many of them are sleepless, and they become hopeless after a while. The first thing I explain to patients is that I can't promise anything to you before we evaluate the extent of your damage, but this is not what you've experienced before. So the intent is different, the treatment is different, and the outcome is different if they qualify for care. And I want to make that point very clear because we don't and can't take all comers. Each patient is given an hour in our appointment slot every time they come. There's only a limited number of 1 hour time slots on a schedule. This is not a revolving door clinic. We have patients that they become increasingly happy and the despair starts to reduce. The hapless and hopelessness starts to reduce as they see tangible change. But most of them have come in basically, and many of them say, "You are my last resort." And I relish in it because I know where they've been and what they've done. And I know they're in front of us because those things obviously didn't work, or you didn't or wouldn't need to have sought us out or have been referred to us like so many patients are.